Welcome to Mom and Mind. This is a podcast all about perinatal mental health and wellness related to conception, pregnancy, birth, loss, postpartum, and new parenthood. But more than that, we aim to deepen our truths, shed light on real issues, speak about our pain, feel understood, and offer a path to healing. We raise the volume on these topics in hopes that someday everyone will have the support and information that they deserve before they need it. Please note this podcast is not a replacement for treatment by a professional or professional training. Welcome back to Mom and Mind. I'm your host, Dr. Kat. We're talking about postpartum anxiety today, and more specifically, what's common and what's cause for concern in treatment. This is a question I get asked about so often, and I'm happy for Dr. Carly Snyder to come on and dispel some of that confusion. We touch on the ever-present guilt and shame that runs its course through motherhood, as well as some of the ways to cope and manage with postpartum anxiety. Dr. Carly Snyder is one of a small cohort of medical physicians in New York City specializing in reproductive psychiatry. Her unique approach combines traditional psychiatric treatment with integrative medicine-based treatments. Dr. Snyder is an attending physician on staff in the Department of Psychiatry at Beth Israel Medical Center. She also holds a teaching appointment at Mount Sinai School of Medicine and is an assistant attending with a teaching appointment at Weill Cornell in the Payne Whitney Women's Program. Dr. Snyder is on the Postpartum Support International Board of Directors as the research chair. She frequently speaks to various audiences such as the Pregnant New Yorker and at professional conferences and meetings. Dr. Snyder is also a member of the Women's Mental Health Consortium, as well as she is the Director of Women's Health for Family Health Associates. Her weekly radio show, MD for Moms, can be heard Wednesdays at 1 p.m. Eastern on the BBM Global Network and TuneIn Radio, or anytime on bbmglobalnetwork.com/MD for Moms. Dr. Snyder's Huffington Post parenting blog shares the MD for Moms moniker. Let's meet Dr. Snyder. Welcome, Dr. Snyder. Thanks so much for being with us.
Thank you, Dr. Kat. I'm really excited to be here.
I am very happy to talk with you today about anxiety, perinatal anxiety, and differentiating between what's kind of normal in air quotes and what we should be more concerned about. I think this is such an important topic and something that I get asked a lot about in my practice. And I know it's very confusing for a lot of moms out there too. So we'll get into that in just a moment, but I'd love to start with your work and what you're doing in the perinatal world.
Well, first off, thank you so much for having me on the show. I'm really excited to be here and to talk with you and your audience. In terms of what I do, I see a spectrum in terms of who. I have patients, women who are, in the process of trying to get pregnant, who some of them aren't even trying yet. Some women come to see me and they are being very proactive. Some of them have a history of maybe depression or anxiety and are on a medication, and they are thinking ahead, and they just want to know what is the safest option in terms of what medication or staying on a medication versus not. And often they will come and stay with me. Sometimes they just want a consultation, but that's usually a starting point for patients. I also have a large cohort of patients who are in fertility treatments. So they've been trying to get pregnant for a long time. And obviously that can be a real struggle when you want something so desperately and it's not coming as easily as one would hope. I have women who are pregnant already and are suffering from anxiety, depression, a combination. Some with more severe illnesses along the lines of bipolar disorder. And I have women who have postpartum illnesses, anywhere from depression, anxiety, postpartum psychosis as well. And what I love about what I do is that I have moms who came to see me in that early stage who have now 1 kid, 2 kids, 3 kids. And I've been able to see them through each pregnancy and, see their families grow. And it's a really rewarding experience.
Oh, that's fantastic. and helping them stay healthy and have
Mm-hmm.
the pregnancies and postpartum that they'd like to have.
Exactly. I mean, one of the greatest things is, being able to say to a woman who is really scared of, a woman who has had a prior postpartum depression or anxiety that really rattled her to the core, and being able to help her through a subsequent pregnancy and postpartum period and seeing her do well.
Yeah.
And having her sit there and say, oh my God, this was nothing like the last time. And I'm so enjoying this time where last time it was so painful. And that's wonderful. That's a great feeling.
That's awesome. How nice to be able to see that and to help people through that. Oh, that's so nice. Especially because so many moms are terrified if, that's going to happen again, or it's going to be exactly the same. And I've been hearing too, well, if it was this bad this time, how much worse is it going to be next time? So it's nice to know, and for other people to be hearing, people who are listening, to know that it doesn't have to be worse the next time.
Absolutely not. Obviously, if you had a prior episode of any mood disorder, you are at an increased risk for a subsequent episode without treatment.
Right.
But it's really important to remember treatment works. Treatment works really well. The biggest barrier is not asking for help. So as long as you reach out and get the right care from someone who knows what they're doing,
right. Yes.
treatment really is incredibly effective. And it is, obviously having more than one child is awesome. It really is. Seeing your kids interact, it is so much fun. That being said, it's a lot of work. Yeah. It really is. So anyone who says having 2 kids is easier than having one has never had 2 kids. But that being said, just because you had a hard time emotionally after your first child does not mean that it's going to be harder emotionally because you have 2 children. Right. If you get treatment.
Absolutely. Absolutely. So what do you see in your practice and with moms who are worried about anxiety or who have anxiety? Yeah. Can you speak a little bit to how anxiety shows up in moms during the perinatal period?
Sure. So, what I stress to women all the time is that anxiety is not the enemy inherently, right? As mothers, we are hardwired to have some degree of anxiety because that's what protects our children. Yeah. And that starts in pregnancy. If we weren't so worried, we wouldn't think one step ahead. We wouldn't be vigilant about, for example, taking prenatal vitamins. We wouldn't be sure to go to our OBGYN and, make every appointment or, reschedule it if we can't be there. We as moms wouldn't be sure to stand next to the changing table. And, there are lots of things, I always think about when a child goes on a scooter or a bicycle or what have you, why do we put helmets on our children? Right. They're very close to the ground. Right. It's really because the what if scenario of if they do fall, we want there to be a barrier between their heads and the ground. Right, right. It's anxiety. It's our anxiety that leads us to be protective. That's not bad. That's actually really good. Right. But when that anxiety is so overwhelming that we no longer can use it just for a positive, but instead it overwhelms our every aspect of our being. So when anxiety impacts your life such that you can't enjoy things anymore, where you're thinking about the negative all the time. And when anxiety takes on a life of its own, and when it kind of goes outside the realm of reality. So there are things called intrusive thoughts, which are actually more common than people think. For example, what if I threw the baby out the window? What if I put the baby in the microwave? What if I trip on my way down the stairs and the baby falls? What if I stab the baby? These thoughts are horrifying. They are scary, but they are not at all psychotic. they sound crazy, but they're not. They're just anxiety, run amok. They're just a lot of anxiety.
Right.
But they are overwhelmingly scary for a mom because what happens is they happen all the time.
Mm-hmm.
So when anxiety makes it such you can't enjoy motherhood
mm-hmm.
or pregnancy for that matter,
mm-hmm.
that's when it's time to get help. Right. I always tell people in my office that I sit in this purple chair, and I very vividly remember with my third child watching my belly jumping up and down as she was kicking and really enjoying it. And that if instead I was sitting there just worrying about kick counts and
mm-hmm.
how often was she kicking or was she kicking enough or what have you, and I couldn't enjoy those moments,
mm-hmm.
well, that wouldn't be fair to me.
Mm-hmm.
It wouldn't be fair to her in the future.
Mm-hmm.
That's, every mom should get the joy of and the wonder of pregnancy, and then the joy and wonder of having an infant. And if you're not feeling that, then there's a problem.
Right. I really appreciate that you are kind of normalizing normal anxiety, that we all have it, and that it's just really commonplace. Because I feel like the word anxiety and the word depression, for that matter, get thrown around now as just kind of another way to describe how you're feeling in the moment. And that might be true, but there's this really other deeper, more intense clinical side where you're describing that it is hard for people to differentiate. So I think the clarification you're giving is really important. In their thought process, they'll notice that change. Have you noticed anything physically or behaviorally that people are doing differently when their anxiety is really high?
Well, I think that, especially in the setting of, really it's in the setting of pregnancy and postpartum, in the setting of anxiety or depression or both, frankly, because what we find is that the two conditions tend to blur a lot. Mm-hmm. Especially, women who are pregnant often are both depressed and anxious. Mm-hmm. A depressed pregnant woman is very anxious usually. There's not many who have pure depression, for what it's worth. Mm-hmm. But anyway, they tend not to take as good care of themselves. Mm-hmm. So I was talking about, going to your OB visits. Mm-hmm. Women who have clinical mood symptoms are not as likely to go to their appointments. They're not as likely to eat as well or healthy foods. They're not as likely to exercise. Energy levels tend to be lower. Mm-hmm. So getting up and out of bed and kind of doing things just becomes that much harder.
Right.
There's always that, well, I'm too tired because I'm pregnant. But in reality, exercise is incredibly important when you're pregnant and when you're not. Mm-hmm. Similarly, postpartum, there's that feeling of isolation that can come in for all of us. Mm-hmm. But when you're feeling overwhelmed in a clinical sense, beyond that, which most new moms feel, women can have a very difficult time getting themselves outside. Mm-hmm. Right. They isolate. They can literally feel physically ill. Mm-hmm. There's a lot of what we call somatization. So, the feeling like I think I have the flu or I feel sick to my stomach. Uh-huh. People tend not to eat as well. Either they eat a lot more or a lot less. Mm-hmm. People can complain of headaches.
Right.
Sleep tends to be very affected.
Right.
So, I always tell women that if there's one thing that can make or break your mood, it is how much sleep you get. So if you get enough sleep, you will feel better. Mm-hmm. If you don't get enough sleep, you will feel worse. It doesn't matter what else you're doing. Mm-hmm. You will feel worse if you don't sleep well. And if your mood is otherwise impacted, so if you are depressed, anxious, what have you, sleep tends to be in short supply. Sure. Or alternatively, you're sleeping all the time. Mm-hmm. In both cases, it's not good. So in terms of physical, you just don't feel good, frankly.
Right. Right. And the whole system is affected. It's not just, mm-hmm. it's not just all in your head, actually.
Not at all. It's not.
Yeah. Yeah.
I do remind women though, there's postpartum specifically, there is the thyroid in pregnancy is naturally suppressed. And then postpartum, there is something called postpartum thyroiditis, where your thyroid goes into overdrive and then it burns out. This can look initially, these are women who initially lose their baby weight often very quickly. And, these are women who may make a lot of baby albums very quickly. They seem very hyper. They're not manic, but they're really hyper for, the first few months even. But then their thyroid burns out and they look very depressed and they feel depressed. They have no energy. They are lethargic. They seem like a woman who has postpartum depression, but they're not going to respond to medication like a woman who has postpartum depression because, in fact, their thyroid is not working. So
at first it looks like anxiety, then it looks like depression?
Exactly. And first, it may not even look like anxiety because often they won't come in to see me at that point because they're actually feeling really good or they're feeling very jumpy, but not to the point in which they'll seek care. Sometimes they will, especially a woman who has a history of anxiety. She may come in because it's a little too close for comfort, so to speak.
Sure, right.
But the second part, that hypothyroid part, that is when people come in because they feel really down. I always check thyroid function because there's no medication that's going to be effective if the true culprit is your thyroid.
Right.
So
that's great. Just for everyone to know, right? To rule that out as a factor of something that's contributing. Fantastic. In terms of anxiety, how might anxiety show up and what types of anxiety do you see?
Well, anxiety is a funny thing. It really depends on your history and your personal situation. But, in pregnancy, anxiety can mean you, for example, hold on to certain words from an OBGYN appointment, right? You have an ultrasound and maybe someone mentioned something and you can't get it out of your mind. And it just plays over and over in your head such that you can't really focus on anything else. And it becomes kind of your world. And you may Google a lot, which as an aside is not helpful.
Right. I
mean, Dr. Google is not your friend.
No.
It really, and I always remind people that in general, as a general rule, not always, but most people who will post things online are usually disgruntled and don't have your story. So you can't really find your personal story or find an answer to your question about, for example, a medication or your situation by Googling it, because whomever is answering doesn't have your exact story and also isn't necessarily giving you their exact story.
Right.
They don't have to give you all the details. So, kind of going through Dr. Google. Also, sometimes anxiety means that a woman will start isolating herself and feeling very uncomfortable in her skin sometimes, right? A pregnancy that may be very wanted all of a sudden feels very difficult to live with.
Right. So you were describing a little bit of, I guess, how I was interpreting is initially it's sort of like an obsessive kind of a process, not being able to get these specific thoughts out of your mind, that sort of thing. And how far can that go in terms of what you've seen of that kind of anxiety?
I mean, obsessiveness can become all-encompassing. So I was talking about intrusive thoughts earlier. Intrusive thoughts are a version of an OCD-like presentation, an obsessive-compulsive-like presentation, that can be very painful and can really take over one's life. Sometimes it'll begin in pregnancy. A key time can be the end of the second trimester, beginning of the third. And then that can carry through postpartum.
Can I ask, is there any particular thing that you've read or researched that shows that why that would be?
It's a key time in terms of hormone changes. So you have some flux in terms of hormones. Plus, at this point, you've had a doubling of your blood volume. But there's some real hormone shifts that have occurred at this point that lead to this massive increased risk
Mm-hmm.
for some women, not all
Right.
by any stretch, but it definitely happens at this point.
Okay. All right.
For
Thank you for
some.
that. Mm-hmm.
And then it can continue. And the thing about it is that women become scared of themselves. They become scared of their thoughts.
Right.
And so they actively avoid different situations in order to try to avoid their thoughts and to avoid what they think may happen because of these thoughts. So if you're having these fears of stabbing your baby, what are you going to do? I've had patients who throw out all of their knives. I have patients who won't walk into the kitchen.
Mm-hmm.
I have patients who will not take care of their babies because they're so fearful of themselves, despite the fact that they desperately want to take care of their babies and are wonderful mothers.
Right. Right. Thank you for adding that. That is so true.
Yeah, it's really important to remember that because you have these symptoms means nothing about you as a mother. It means nothing about you as a person. And it means nothing about what you will be in the future as a mom.
Mm-hmm.
Nor does it mean that I've had women who say, maybe I actually don't want to be a mom, and that's why my brain is doing this. No, absolutely not. This is just your brain. This is a manifestation of anxiety.
Mm-hmm.
And just like if you had diabetes, we would say, okay, your blood sugar going awry. This is your anxiety going awry.
Mm-hmm.
This is nothing you did wrong.
Right.
This just has to be treated.
Right. Yeah, that is so key. I hear this so often. The anxiety is so high that it is making people question themselves and their ability and who they are as a person and why is this happening. And it's just anxiety is creating its own anxiety.
Mm-hmm. Yeah.
Mm-hmm.
And it can really women who have wanted to be mothers for, ever, all of a sudden are petrified of themselves, of caring for their babies. And then there's this level of guilt that comes in. How could I be thinking such terribly dark things?
Mm-hmm.
Because intrusive thoughts can be very dark.
Mm-hmm.
They can be sexual in nature. They can be violent in nature.
Mm-hmm.
And none of that is, in fact, because there is any drive towards sexual activity. There's no drive towards violence. This is, again, just the brain going a little haywire, but it's all very treatable.
Mm-hmm. Yeah, that's right. I really hope that people can hear that because it's hard to be afraid of your own thoughts. It's paralyzing sometimes. And really, oftentimes women aren't talking about this part of it because there's all the shame and guilt that comes with it too.
Right. And the problem is that people become very scared that if they tell anyone what they're thinking, something bad is going to happen. So, they're going to be looked down upon. Their partner is going to see them as a bad mother. Their OBGYN or, their internist is going to call ACS. Their mother is going to think that, they're going to hurt their child. All of these things, which, is not true, hopefully. And if it is, it means that there needs to be more education.
Right, absolutely.
Right?
Yeah.
That what needs to happen is people need to understand that none of that should be going on, right? Mm-hmm. This is not an ACS case. This is not something where a child should ever be removed from a home because of intrusive thoughts, just to be very clear.
Yeah, right. Mm-hmm.
And this is not because a mother is in any way an unfit mother.
Right.
She is 100% fit. She just needs help. And it's important to remember this can be difficult for a marriage because partners often very much want to help, but they have no idea how to.
Mm-hmm. Right.
And they know there's something wrong, but they can't figure out what to do. Mm-hmm. And in truth, beyond being supportive, there isn't always a perfect fit in terms of what to do.
Right.
Beyond saying, I love you, I'm here for you, and let me help you with the baby, they can't make it better.
Yeah. That reminds me of some women who've come through who have such high anxiety, but also don't want anybody else to help them with the baby. Like they cannot stand other people holding their child because of the anxiety. And in part because of their own intrusive thoughts, but that something's going to happen to their kid, but just trying so desperately to control and manage the care of the child that relationships are affected too, that the partner feels ineffective or not able to help because of that high anxiety.
Oh, absolutely. So I very strongly recommend that women bring their babies in at least once, in the first few weeks. In part because I want to see how they're doing with their baby. And in part because I always offer to hold the baby. That is A, selfish because I love holding babies. But B, because I want to see how they react. I want to see if they look at me like I have two heads and hold on to their babies for dear life. Or if they say, oh, of course. Now, most of them, and now I know these women well, right?
Right.
I wouldn't say this to a woman who I'm just meeting for the first time. These are women who I've been treating. So we've already established a trust between us.
Right. Yeah, that's important.
Right. That's an important part because given that, it would be odd for a woman who, she and I trust one another. Now I'm saying, hey, I'll hold your baby for a moment. For her now to all of a sudden feel very guarded and fearful.
Right.
Why is she scared of me?
Right.
There's something going on, right? She may not overtly tell me I'm not letting anyone else hold my baby. Often, frankly, she will tell me that. But seeing it firsthand is even more telling. And it's, as you said, you nailed it. Like, it's fear. There's a control and fear. What if I'm not holding my baby, if I'm not the one taking care of my baby, I can't be sure that my baby's fine. I can't be sure that he or she is being held properly, is being burped properly, is actually lying on his or her back in the crib, etc. And I always remind moms that you have to be sure that you trust whomever you give your baby to, but you cannot be connected to your baby forever. It's not good for you or your baby.
Right. So to encourage them to have the baby develop relationships with other people.
100%, both for the baby, but also moms need time to themselves.
Right.
And both for themselves and, for friendships, but also for marriage. It's important to go on date nights. It's important to have time, the two of you. You guys liked each other before you were parents. That's how, for most people, that's how you became parents. But you also just need time as adults.
To connect and
And it's important that as women, we reconnect with ourselves as people, because before you were a mom, you were still a woman. You had interests, you had things you like to do, you had people you like to hang out with. You can't lose all that just because you have a baby.
Right. And also, if your anxiety is super high, then you're not, from what I think and what I've seen is that you're not really connecting to yourself as much anymore either. You're so highly focused, or to the baby, right?
Babies can read anxiety. It's a pretty amazing how tense a baby will be in the setting of a tense mom. I've obviously been around a lot of babies, 3 of my own, and I'm not nervous holding a baby. I can say that with great confidence.
Yeah.
I have some moms who come in who are very anxious overall, and their babies, they will say, oh, my baby's so fussy.
Right.
They're so fussy. And I'll always say, well, you want me to give it a go? Please. Yes, of course. Please try. And within 2 minutes, baby's calm as can be. And there's no secret. It's just that I'm not nervous. I'm not worried. And babies tend to be able to read whether you are worried. If you're calm and you are kind of relaxed holding a baby, they're much more likely themselves to be calm and relaxed. So for a mom, it behooves us to take a deep breath.
Yeah.
And kind of relax. It also, by the way, behooves us to sleep, as I was saying earlier.
Yes.
And that means being able to, relinquish some control to someone else. If you want to exclusively breastfeed, okay. That's, everyone has that choice, but that doesn't mean you have to do all the work all night. You can also rely on a partner or, your mom or whomever to get the baby, change the baby if needed, bring you the baby. And then after you feed the baby, take the baby, burp the baby, do all the hard stuff, at least every other wake up.
Sure.
Because that still means that you're sleeping, a good hour more than you otherwise would.
That's a great point. Right. And the lack of sleep is feeding into the anxiety anyways.
Oh, absolutely.
Oh, yeah. I mean, it's really challenging. I've heard some moms, realize that their anxiety is affecting their child, but then also feel guilty about that and sort of feel the weight of the world on them. Like, oh my gosh, I have to not be anxious in order to not mess up my kid and, kind of take it to this other level. But you gave a really good point that just taking long, slow, deep breaths while you're feeling that way, while you're holding your child, can help you and them too. And that, you're not necessarily, I'm going to add too, that you're not, ruining your child if you feel anxious, that there's lots of room for healing and recovery for you, but also that's a really good tip to take a deep breath and try and soothe yourself, which also soothes the baby.
Oh, I agree with you 100%. It's easy to run down the path of, oh my gosh, my anxiety is doing X, Y, and Z, and then like feeling worse and feeling guilty. But no one gets anywhere that way.
Right.
And instead, there's so much that can come out of holding your baby for a minute and breathing them in and literally being in the moment and trying as hard as possible to erase everything else out of your head.
Right.
And it takes real effort.
Yeah.
And the more anxiety you have, frankly, the more effort it's going to take. But, it's sort of like your first piece of homework, giving to yourself is just enjoy the moment for what it is, for a quiet moment. And babies can be incredibly calming if you let them. If they're asleep on your chest, just like sit there, and allow them to help you. And also allow yourself the piece of like, it doesn't matter if you didn't email that friend back. It doesn't matter if your house looks like a tornado just came through. Right. It doesn't matter if you have ordered takeout for the last 2 weeks, 3 weeks, 3 months.
Right.
And if you are wearing the same pair of socks and the same bra and you haven't combed your hair in like however long, nobody cares. And you are allowed to look however you want to look. It doesn't matter. What matters right now is this moment.
Yeah.
And that's it.
Yeah. Oh, that's so great. I think that speaks right to the heart of anxiety, right? Because it's all future oriented and I got to do this and I need to do that. And what happens if, and the list of things they need to, attend to. And I mean, that's just a really fantastic coping skill, is to allow yourself to let that go and be in the moment.
And, it's a work in progress for all of us. It's very, obviously it's so easy to say, right?
Yeah.
But in practice, it's every day we all have the opportunity to think through in any one experience, how we're going to handle it, right? And in truth, no day can be filled with all the positives, right? Yeah. We all have to be real, and we all have, especially as our kids get older, we all have the responsibility of making sure that our kids, eventually go, become responsible adults. And that means not always having fun, not always being relaxed, right? We have to at some point be adults ourselves. But it means that we can enjoy moments where they come up and kind of having the risk-benefit analysis in our heads. And as moms, realizing that every day and every moment doesn't have to have so much weight.
Right.
If you screw up one moment, it's fine. Who cares? It's okay. You make it up the next moment, the next day. Everything is going to be okay as long as you believe it's going to be okay.
Right. So, I mean, I think you're giving some really good tips on how to cope with all of this. I'm hearing, give yourself a break and taking deep breaths and being in the moment and letting some things go. What other kinds of things have you seen that have been really helpful in terms of managing anxiety and healing?
I mean, I think the most important thing, number one, is getting more sleep.
Mm-hmm. Right.
If you look at your 24-hour period and you are getting less than 8 hours of sleep, there's a problem.
Mm-hmm.
Your anxiety cannot improve without consistent sleep.
Yeah.
So a lot of women look at me and they're like, but I have a newborn. Are you joking?
Right.
And I'm like, well, part of it is planning, getting help. You don't need to do it alone.
Right.
Right. The notion of it takes a village, that is legit.
Right.
And find your village and get the help you need. Because whatever it looks like for you, sleep is the most important component to all of this.
Yeah.
There is no one in the world who feels okay with consistent absent sleep, lack of sleep, right? We all just feel awful, and there's no manual that says, oh, by the way, the first 3 months are going to be hell and live with it. And if there's a manual out there that says that, it should be, taken off the shelves.
Right. Right.
So the first way to cope is to get more sleep.
Yeah.
And the second is to eat healthy foods and make sure that you continue to eat. In pregnancy, women tend to remember to eat more.
Yeah.
Once they have the baby, all of a sudden the needs focus on the baby and less on us. But you do need to continue to eat and drink enough. So make sure that you have healthy snacks around. Make sure that they are out and visible. I would much prefer someone have a Kind bar or, some kind of protein bar in a free few minutes than take a shower. Take the shower later in the day or the next day.
Right.
No one's going to die from being stinky, but you need to eat something.
Right.
The other thing is to go outside. Women get very worried about the notion, well, my baby's not vaccinated yet, so I can't take him or her outside at all. You don't need to go into the middle of Times Square.
Right.
But bundle your baby up and go for a walk around the block. If someone comes up to the baby, be like, hey, can you keep your distance? It's flu season and my baby doesn't have his or her shots. She's too young. Or just don't stop and just pretend you have earbuds in, or maybe do have earbuds in and just keep on walking. But getting outside is incredibly important and incredibly helpful for your mental health. And it feels good to get some fresh air.
Sure.
And if someone tells you the baby's too young, just, walk on by. The baby's not too young. And, if all of this fails, if you are doing everything to better yourself in terms of taking care of yourself appropriately and nothing is working, reach out for professional help. Therapy can be incredibly helpful. It really can. Working with a person who is trained in this, who is not a relative, who doesn't have a vested interest in any of it beyond helping you, can really make a huge, huge difference in your every moment. If therapy is not enough, medication can be incredibly helpful and really can also help kind of break through with therapy. The combination can be like make your world open up, and all of a sudden you're like, wow, that's who I really am. That's who I was. I found myself again.
Right.
Not every woman needs medication, but for the women who do need medication, it can be life-changing in a very positive way.
Right.
And remember, just because you start medication does not mean you're going to be on medication forever. But it also doesn't mean you should stop it the second you feel better. Talk to your provider. Make a plan, but don't cold turkey stop it like in a month when you feel better. Give yourself a little time. There's no shame in remaining on it for a little while longer because it's helping you. That's great. Give it a little time to work and then work with them in terms of titrating down if you need to.
Right. And that's fantastic. I mean, a lot of those things people can start. I mean, if they're listening and they're realizing they're feeling anxious, and those are things that they can try and incorporate now, in terms of sleep and getting outside and eating better. And yeah, there are a ton of us who are here waiting to help and happy to help. And that I just really, love your perspective. And it's what I'm hearing anyways is like, do what works for you. And there's nothing wrong with any of that.
I think that as moms, we are fed this one way is best idea, right?
Right.
We watch on TV and it looks really blissful, and babies are born and they're like 3 months old already on TV. Every baby is like 14 pounds and they're completely clean. And there's this like thing, it almost seems like when you're pregnant, there should be butterflies flying over your head.
Mm-hmm.
And if that's not happening, it's this notion that you're wrong or something is wrong with the picture. And in truth, there's nothing wrong with you.
Right.
You're just experiencing anxiety and you're not alone, and you can absolutely feel better with appropriate life changes.
Mm-hmm.
And they don't have to be hard.
Mm-hmm. Right.
They can really actually be quite intuitive.
Right.
And or some help from people like us who do this for a living with day in and day out with other women like you.
Right. Yeah. Yeah. Well, thank you so much for all of that and the hopeful messages, that people can get through this, and really differentiating kind of what is okay in anxiety and kind of, again, in the air quotes, normal, and what we should be paying a little closer attention to and maybe getting some extra support for. It's really important for women to have this information, to be able to decipher it for themselves, because they don't always have a professional who's able to help them decipher it for them. So I really thank you for your expertise and your ability to differentiate that for us today. Thank you so much for coming on.
My pleasure. Thank you for having me. This was great.
Great info, right? The more we can understand these things, the easier it will be for us to cope and heal. If you'd like to connect with Dr. Snyder, please go to carlysnydermd.com, where you can find links to her radio show as well, and connect with her on Facebook or Twitter. For this and all episodes of Mom and Mind, please go to www.momandmind.com. Join us on Facebook, Twitter, and Instagram, as well as our Facebook group, Mom and Mind Connection. Until next time. Thank you for joining us today. Our hope is that you leave here feeling heard, understood, and hopeful. Please share this podcast. Together we can support moms and families so that no one has to deal with this alone. Come and connect with us on Facebook and Instagram at Mom and Mind.